Blackouts and dizziness. Dizziness is a non-specific term that refers to abnormal sensation of body orientation or position in space. And these include feeling of unsteadiness, lightheadedness, and vertigo. Patients often find these sensations difficult to describe. Dizziness is almost always associated with other symptoms. So, a careful history and focused physical examination should be performed in all cases to identify the cause. Like dizziness, blackouts is just a vague descriptive term implying either altered consciousness, visual disturbance, or a sensation of falling. And a careful history, particularly from an eyewitness, is essential. Episodes of transient disturbance of consciousness and falls are common clinical problems. It is usually possible to distinguish between a fit, as a seizure, an episode of fainting, and other types of attack from the history given by the patient and the account of an eyewitness. So the causes, cardiovascular causes are vasovagal, that's fainting, postural hypotension, acute hemorrhage, cardiac arrhythmias, severe aortic stenosis, complete heart block with Stokes Adams attack, and vertebrobasilar insufficiency. Also, cerebral causes, transient ischemic attacks, strokes, epilepsy. Others include drug-induced severe anemia, hypoglycemia, middle ear disease, Meniere's disease, conversion disorder in hysterical fainting or hyperventilation. The symptoms are lightheadedness, loss of consciousness, sense of motion or spinning of body, unsteadiness, nausea, vomiting, and tinnitus. The signs that are usually elicited are sweating, which suggests vasovagal episode or hypoglycemia, tachycardia or bradycardia, which suggests cardiac arrhythmia, and also hypotension, postural hypotension, pallor, nystagmus, ataxia, hypotonia, dysarthria, which suggests cerebral cause, and also this diadochokinesis, and also focal neurological signs, which suggest stroke, and also transient ischemic attacks. Investigations vary depending on the cause. Others are FBC, random blood sugar, X-ray of cervical spine, and ECG. So the treatment objectives are to identify and appropriately manage the possible underlying causes. Non-pharmacological treatments are postural hypotension, you have to review medications, and hyperventilation syndrome, breathing control exercise, counseling, cervical collar, and also molded cervical pillows. Pharmacological treatment to treat the underlying cause appropriately. Referral criteria: you refer patients to a vision specialist for evaluation if the cause is difficult to determine, and if the cause is identified, refer to the appropriate specialist for further evaluation and management.